Greetings everyone. Welcome to the learning of ECG basics. If you have not checked my first video, please do check that. Now let's get into the leads and axis basics. What is lead? Lead is an electric picture of the heart, not the wires connecting the patient to ECG recorder. So usually when you visit your hospital, you can see three wires that connects the ECG to your body. One is connected to your right arm, another one is connected to your left arm, and last one is connected to your left foot. The line connecting your right arm to the left arm is called as lead 2. The line connecting your right arm to the left foot is lead 2, and the lines connecting your left arm to the left foot is lead 3. Now, how many leads are there total in an ECG? So, there are 12 leads, out of which 6 are limb leads and 6 leads are your chest leads. Now, which all areas are represented by these leads? So, your lead 1, 2, and VL represents your left lateral area of the heart. Lead 3 and VF represents the inferior aspect of your heart, and lead VR representing the right atrium. Coming to the chest leads. So, how many chest leads are there? Again, 6 chest leads, among which V1, V2 represents your right ventricle, V3 and V4 represents your septum between the ventricles and the anterior wall of the left ventricle, and V4 and V5 represents the anterior and lateral walls of the left ventricle. Now, let us see what is right axis deviation. So, for axis deviation, you need to check lead 1, 2, and 3. If the lead 1 is in negative polarity, that means if you get a downward wave in the lead 1, that indicates right axis deviation. So, what causes this right axis deviation? Is it easy to remember? Right side pathology, secondary to your pulmonary condition, put a strain on the right side of your heart, and also with congenital heart disease, this can be seen. Coming to the left axis deviation. So, which all leads you will have to see? Lead 1, 2, and 3. Again, if you get a negative polarity in lead 2 and 3, that means if you are getting downward waves in lead 2 and lead 3, it is called as left axis deviation. And why it is happening? It is due to a conduction defect rather than the increased bulk of left ventricular muscle. So this is all about your axis deviation. Now, are you ready to find out the axis deviation in this ECG? Yes. Which axis deviation? So this is your, yes. You can find your answer and comment below. What are the final tips and takeaways? Take a notebook and write down your takeaway points and put your queries in the comment box. Thank you for listening to this video. Have a nice learning.